My name is Patrick Casey, and I'm the Director of Corporate Communications for the Regional Municipality of York. Very pleased to welcome all of you here, and pleased to welcome you on very short notice, so we certainly appreciate that. I want to welcome you to the City of Markham and to our press conference today. We know that there has been a rise of misinformation about the coronavirus, and that includes impacts within our communities. We are taking today and this opportunity to provide the public, through some of our media partners, with an update on true and accurate information as it relates to coronavirus. We appreciate you attending, and we thank you for sharing our messages with those on your media channels. Your work directly helps the work of public health, and it helps our communities as a whole. First, you will hear from Dr. Karim Kurji, York Region's Medical Officer of Health, and he will provide an update on the current situation in York Region. Yvonne Chung, Manager of York Region Public Health, will translate Dr. Kurji's remarks to Cantonese. Lin Huang, a York Region Public Health Inspector, will translate Dr. Kurji's remarks to Mandarin. Inshallah Javamadan, a York Region Public Health Nurse, will then translate Dr. Kurji's remarks to Farsi. Translated into 3 different languages will take some time, so we please ask for your patience. His Worship, Mayor Frank Scarpitti from Markham, will then provide remarks. We will then have an opportunity for questions. Dr. Kurji.
Good afternoon, everyone. We understand there's a lot of anxiety in the community with respect to this novel coronavirus. And my purpose today is to try and give you some facts so that we can try and allay some of these anxieties that are present. As someone who was at the forefront in the fight against SARS, I can truly identify with these concerns. Now, to begin with, the situation in China is very different from the situation here in York Region. And that's the first point that I wanted to emphasize. We do not have the sorts of risks that are existing in China. We here have a very low risk of contracting the virus in the community as a whole. All the cases that have been identified in Canada can be linked to Wuhan or Hubei province. So we are in a very different situation altogether. After the initial remarks, we will be happy to take any questions that you have so that we can get deeper and deeper into some of the anxieties that the community has. Most of you already know enough about the coronavirus from the media reports, but I'm happy to expand on any of these facets. In public health, we work as a system. So we have the World Health Organization higher up, then we have the Public Health Agency of Canada, which works with the World Health Organization and with the provinces. So we have the Ministry of Health at the provincial level, and we have Public Health Ontario in Ontario. And then we have the local health units, and we represent York Region Public Health. I want you to understand that each one of us has slightly different roles, and all of us work as a system together. We also work with our partners in the healthcare system, be they hospitals, primary care physicians, and others, and we're in close contact with all the infectious disease people at the different hospitals. So I want to assure you that it's a coordinated approach, and we are constantly vigilant and working together to prevent the situation that exists in China to become a situation here. And I will expand a little bit further after my initial comments. So with that, I hope that you will have the opportunity to ask me any questions that you wish to ask. And I have to stress to you that the novel coronavirus is a new virus. We don't know as much about it as we may know about other viruses. And so the situation is constantly evolving, and we're learning more and more. But I can share with you that which we know in order to help you understand the situation better and hopefully allay the anxieties that people have. Thank you.
Well, good afternoon, everyone, and I want to say Kong Hei Fai Choi, first and foremost, Shen Yi Kwai Lo, and thanks to First Markham for agreeing to host this press conference here at this amazing mall, one of the best food courts, by the way, in all of the Greater Toronto area here. I also want to say thank you to Dr. Kurji and his team at York Region Public Health for coming out. I continue to be very confident with the information that all public health officials at the federal, provincial, and local level continue to share with the public. The messaging has certainly been consistent and very clear about the low risk to catch this virus. And I want to say, though, I'm glad we're here in the city of Markham at a Chinese shopping mall, not in a government office somewhere, but out here with the community, sharing the information. I've been advocating all week that all public agencies share information in various languages so that it's not being interpreted by someone else. There isn't misinformation being spread through WeChat or other social media channels, but that you're actually hearing it directly from the public health officials in different languages, so there's no room for misinterpretation. So I remain confident and very pleased and thank York Region for holding this press conference here in the city of Markham at a Chinese mall. And I know I saw Jackie Armstrong here, but thank you to Jackie for always opening the doors here at First Markham, as this is a place where the community comes together. I just want to touch on a couple of things. It's certainly been encouraging news to see that the numbers remain so low with those that have been identified with the virus. And I think at this morning's press conference, at the Ontario press conference, was also indicated that healthy, resilient adults are somewhat resistant to this virus. Obviously, young children, those that might be elderly, those that might have health issues are more vulnerable. But even with those individuals, it would take interaction with those individuals in close proximity, and I think if I heard it correctly, over a long period of time. And so again, I think it puts things in perspective about how low the risk is to catch this virus. And so first and foremost, it was important to deliver this message in the various languages, and York Region Public Health will continue to do that. I'm also proud here at the City of Markham that our staff have taken the extra steps of doing some additional cleaning, also making sure that people understand to take the normal precautions as you would during the flu season, to wash your hands. We've provided more alcohol-based hand cleaning ingredients at all of our recreational centers. And I want to say thank you in particular, and I would never fault anyone for taking whatever precautions they feel most comfortable with. However, I will say this, I want to congratulate the Chinese business leaders and the organizations in our community who, based on the information that's been provided by the public health officials, have continued to celebrate the Chinese New Year and have held their events throughout the week. Yes, some have been canceled. Some of those events did involve young children. Some of those events did involve seniors. And so again, I understand why organizations might take the extra step. But I do want to say there are still a lot of Chinese New Year's celebrations happening this week and next week that are going on as planned. And even tonight, it's very timely I'm having the mayor's Chinese New Year's dinner, and after again listening to the information provided to us by the public health officials, reiterating the low risk with this virus, we are proceeding with that Chinese New Year's celebration. And again, I think it sends a very strong signal, not just myself, but other political leaders from our council and from the other levels of government will be there tonight celebrating and interacting with the community. And so I'm going to leave it now for any questions from the media. I want to say thank you to all of the outlets that have come here this afternoon. And if I could challenge you a little bit more to invite any of our staff, either with an additional interview on the radio, on your television stations, because I do want to make sure that the various cultural communities get this information directly in the language that they understand best. And I think it's critical when we have an issue that does create some anxiety and perhaps some fear in the community, and I think we would expect reassurance when the risk is so low that again people hear it in their language. So I do challenge the media. I thank you for coming out here today, but please rely on these local experts as we continue to monitor the situation in all our communities across York Region. And I thank you very much for coming out here today.
Thank you. Jennifer has a microphone, so she will facilitate your questions so our panel can hear them. Any questions from the media?
Okay, hello. My first question is, so the WHO has just declared a global health emergency. What does that mean? Do you still believe it's low in Markham or in York Region?
So thank you for that question. When agencies declare emergencies, sometimes this is to facilitate resource mobilization. And this is often the rule with respect to many governments as well. For us in York Region, it really doesn't change anything. As far as the risk to the community goes, it's very low. So let me explain a little bit further. Nobody in the community appears to have acquired coronavirus from somebody else within the community. All the cases that have been identified so far in Canada have acquired it from China. It's because of travel to China and those individuals then develop symptoms that we actually have those cases. So at this point in time, there isn't any acquisition of any cases from within the community. So let me explain this a little bit further. We in York Region Public Health, at the ground level, receive from time to time reports of individuals who may have traveled to China and have now developed symptoms. And when I talk about travel to China, it is usually, I'm referring to Wuhan or Hubei province. When they come with symptoms, they have always, so far, self-identified. And when they have self-identified, either to us or to the healthcare system, we are able to take detailed questions and do a detailed assessment and facilitate testing where they are symptomatic. And we ensure that they are put on home isolation. In addition to that, we follow up on their close contacts. As the mayor alluded, the disease is not transmitted casually to people, as far as we know. You need to have prolonged and close contact. So what do we mean by close contacts? These are usually household members who may have provided care, like with feeding or with bathing, etc. So these would be close contacts. So we would then call the close contacts and check whether they had any symptoms. If they have no symptoms, then they're allowed to go about free. If they do have symptoms, then we ask them to self-isolate until such time as the test results come back. So that is a process that we have been following time and time again. So every day we may have somebody or the other, who identifies themselves at a given hospital or through us, and we follow them up until such times as the test results come negative. So we believe that we have a very effective system at putting a ring around not only the case but the close contacts. And hence we are going to try very hard to prevent this disease from getting out in the community. So at this point in time, we have no one in the community who has acquired it from within the community, and certainly in York region there are no confirmed cases anyway at this point. Having said that, don't be surprised if in the next few days or in the next few weeks we do have a case. But if we do get a case, rest assured that we would have already known about this individual, since they would be a person of interest whose test comes back positive. And we would have put a ring around their close contacts. So the risk to the community is not likely to go down. Thank you.
So, one jewelry store in Markville Mall has been closed due to the possible coronavirus infection. So rumor has it, on the WeChat, people are saying one of the employee was on the same plane with the first confirmed case in Ontario. So what do you want to say to the customer who has visited to the store and the other retail store in the mall?
Thank you for that question. There will be many rumors circulating. I can tell you that there is no risk to people in Markville Mall, no greater risk than what may have existed several weeks ago. So let me explain to you the situation with respect to people on the plane. There were some 37 individuals who were in the business class section, where those two individuals, the confirmed cases, had occupied. Out of the 37, 15 individuals are York Region residents. We have contacted all of them, and 14 of them have got no symptoms, and one individual has symptoms and is being monitored by us. So there is no risk from those individuals to the community, since that has been contained. Now, there are individuals who were not in the business class, and some of them have developed symptoms. Those that have developed symptoms are being monitored appropriately. So, and we are keeping a tab on that. So again, as I explained earlier on, what we do is for those that have symptoms are on home isolation, and we also contact the contacts, the close contacts. Moving around in the mall is regarded as a casual contact. So even if somebody was symptomatic and moved around in the malls, we do not expect them to be able to transmit the disease to anybody else. So this is why I'm sort of mentioning again that the disease is transmitted through droplets, and these droplets have to be transmitted to somebody who is in close contact. That's usually how the disease is transmitted. Now, we can all do certain things to prevent ourselves from getting infected in general through many of the respiratory viruses that go around at this time. So these are the influenza viruses. I will run off a list, and I will ask my counterparts really to translate those as well. So one of the first things is washing our hands regularly, frequently. We have to take care that we wash under our fingertips, between our fingers, near the wrist, and where possible we can use soap and water. But when that's not available, we can use an alcohol-based sanitizer. Alcohol is very effective at killing the coronavirus. The second issue is if we happen to cough, make sure that we use a tissue paper or cough into our sleeve, and the tissue paper should be appropriately disposed. We should try and avoid being close to people who are sick. Generally speaking, you want to stay away at least 2 meters away from people who are sick. you also want to ensure that if you yourself were sick, that you tried not to mix in crowds and try to stay at home until you're well. That way we can keep the rates of infections in the community down. So it's very important that we follow all these things. In addition to that, you don't really want to share utensils with each other. So these are ways in which saliva and droplets that one might have if one was infected with influenza or other viruses, or even the coronavirus, could get around. So what we're trying to do here is to interrupt the chain of transmission. By doing so, we would be keeping the levels of infection in our community low. I just wanted to clarify something, as I have been asked, there may be some confusion there. There is no coronavirus, novel coronavirus in York Region that we are aware of at this point. Okay, so I want to clarify that. But from time to time, we do get people who we might suspect that they might have the coronavirus, and these would be individuals who have traveled from Wuhan or Hubei province and have developed symptoms that are compatible with this virus. So those are the individuals that we closely follow up and usually put them in home isolation and follow up their contacts. But I want to say emphatically that so far there haven't been any individuals with that particular virus in York Region. That having been said, as I said, maybe in the next few days, maybe in the next few weeks, there might be a case. But I don't think it will change our approach at all, as we would have contained the case as well as the contacts. Thank you.
Mayor Scarpitti will provide some closing remarks.
Well, I just want to once again thank the media for coming out this afternoon. I think it's very important now that you've heard directly from representatives who've been able to speak in Mandarin and Cantonese and Farsi to be able to communicate the correct information to the Chinese community. I know that Patrick in a moment will give out the phone numbers as well and websites if the Chinese community wants to get additional information. And certainly over the next week and couple of weeks, we'll continue to provide information in various language so that people will understand the information. Again, no risk of misinterpretation or misinformation continuing to be passed on. So once again, Jackie, thank you very much for allowing us to come into First Markham. This is an amazing place, and there's no reason why for the Chinese New Year's that the community cannot come out and eat and shop and enjoy what this establishment, among many others in the city of Markham, has to offer. And again, thank you to all of the public health officials for the great work that you do, not only now, but really throughout the year in ensuring that the public is kept safe. Everything from immunization to restaurants being inspected, and certainly providing information on a variety of different health issues. Again, I think it's best when we have the right information, not rumors, not misinformation. So again, thank you, Dr. Kurji, and to the entire team. And Gong Hei Fai Choi, and continue to enjoy the new year. Xie xie, doche.
Thank you. Thank you, Mayor. Health Connection, York Region Health Connection is open Monday through Sunday. 8:30 a.m. to 4:30 p.m. are the hours. That number is 1-800-361-5653. Telehealth Ontario is available at 1-866-797-0000. And at all times, the most accurate and up-to-date information for York Region can be found on our website at york.ca/coronavirus. Thank you very much.